This week on the Backtable Podcast.
So I think there's opportunities for a company like Neuwave, which already has a great market and people already aware of it and already own a lot of the equipment to continue on. But if it doesn't, we'll find another way. We're IRs, we've been innovative and things have changed and we've always found a way to not just continue on, but to push the envelope and get better every time that happens. And we'll find a way to do it here. And that's not going to be the same reaction as a surgeon who's like, whatever, I don't care. But we'll find a way to make it happen. So in all the ways, I hope it sticks around. And the more competitors you have in that space, the more all the companies are going to innovate. Mm-hmm. The more they're all going to invest with their IR researchers to do new protocols and new trials and make better devices. And so I hope there's more of these companies, not less. And so for that reason, I really do hope they stick around. But if they don't, we'll find another way.
Today, we were talking about Neuwave and Johnson & Johnson's decision to wind down their Neuwave microwave ablation system. To help us with this discussion, we have on the show Dr. Josh Kuban from MD Anderson in Houston, Texas. Josh, welcome back to the show.
Hey, thanks for having me. It's been a couple of years, but I appreciate you inviting me back.
For those who may remember Josh's old episode, we actually talked about microwave ablations, and I think Neuwave sponsored that episode, maybe?
I think they're involved.
Yeah, I think so. Anyway, so update everybody. How's the practice going at MD Anderson?
It's great. Last couple of years, doing a lot of ablation, doing a lot of IO, also a lot of vascular work and portal work. So we've hired a lot of people, which has been pretty cool, having some new junior faculty. My role has changed a little bit, kind of becoming mid-career, although I don't know if I would describe myself as that yet, but it kind of feels that way with a lot of the junior people. But it's been fun to see people you've trained and people you've known as students and residents come through and now be attendees, and a lot of times be better than you in a lot of things. So that's been pretty cool to be a part of.
How many people, how many IR docs in your section?
I think we're 30. It's huge.
Holy cow.
It's insane. Now, some of those are 80% research. Sure. There's a couple of PhDs, but I think there's at least 28 practicing IR, doing cases. And we have all these new sites, area hospitals that are out in the community and outpatient centers. So it's really been expanding quite a bit, but 30 is a huge group. It's really, it's a monster. And it's not even, there's no DR in our program. We're totally separate from DR. So it was actually pretty impressive. We have, even though there were a lot of people, we function pretty well. I think a lot of that's our chair who's, pretty chill. And I don't know, everyone's pretty motivated to do their own thing and works pretty well together. We're not all best friends, but we're all working really well together, I think.
That's awesome. Doing plenty of ablations, doing a fair amount of interventional oncology, you're MD Anderson. So let's introduce the topic. So Johnson & Johnson decided to wind down their microwave ablation system, Neuwave. And at least in the Backtable opinion, this was something that we wanted to talk about, to do a couple of things with. But one of the things that I did want to go to was recognize that Neuwave specifically has done a lot of, or generated a product that's given a lot of safe, effective procedures for thousands of patients. And I just wanted you to speak to that sentiment.
Yeah, I couldn't be happier. There's a reason why I use it for all my ablations. It's a great product. It's a great team. I've always felt well supported, good group of people. And really, they've actually done a lot over the past bunch of years to build new software. I don't know. I feel very comfortable with it. I was a little taken aback when I heard that it was going to be shutting down. It was a bit of a shock. But yeah, I appreciate all the work they've done over the years to help grow the practice and what it's allowed us to do for patients, really deliver great treatments to thousands of patients. And so that's going to be a big loss if indeed it goes away.
One thing I also want to say is that I have felt like the Neuwave support staff, the people they send on site to help you either get your program up and running, have always been fantastic. Super well trained, super helpful, nice to work with. Your practice, doing as many as you do you have the Neuwave representatives come in for the cases, or sometimes they're there, sometimes they're not?
Not that much anymore, but I think when I was first using it, and then when I first learned to use ablation confirmation,
right?
Mackenzie Dabdoo, she's our kind of local rep, and she would come in all the time. Somehow, I don't really know how she knew I had cases, but she'd always just kind of be there. And still sometimes, but I think once you are really familiar with something, use it well, you don't really need the rep or even want the rep coming in for every case, although it'd be great to see her all the time too. But she does come in for a lot of the cases, especially I mean, a lot of times we'll have 3 rooms doing microwave at the same time. We have like 4 of these machines. So like she's probably needed in rooms that are not with me just because I've done a lot more of them. So I think like her presence there and probably extending nationally, them coming in, being there, showing people how to use things, what it can do, and doing it in the right way where you're kind of not overbearing, but still educating, I think has been pretty pivotal to their growth and to Neuwave's growth. So I think they did a good job hiring people. And on the education side too, there's a lot of people that I think have learned through courses or things we do at annual meetings to help teach people like what the system can do. So, I've worked a lot with Ellen Henderson doing that. And, I think she's been great at growing a lot of the educational offerings that Neuwave has been able to do over the last 10 years, really.
I want to also share one of the reasons that I like Neuwave. All the reasons that you said are absolutely valid. One of the other reasons, I heard Fred Lee, when I was a resident, give a grand rounds of what it was like to start Neuwave or start, microwave ablation. And, correct me if I'm wrong, but like Fred Lee, he didn't invent microwaves, but he invented the microwave ablation system first on the market. And basically his story was a story of, at first, there was just a lot of roadblocks to getting it going. He gets it going. Everyone's doing RFA at the time, so everyone shits on him. And then after publications, years of good experiences, years of good outcomes, then the next half of his career is people just ripping off like exactly what he's been preaching for like 10 years. And like shamelessly, it was like shameless. It's like, oh no, this microwave ablation doesn't work. It's dangerous. And as soon as he creates critical mass, everyone's like, oh yeah, we're going to get our own microwave ablation systems going.
Yeah, that makes sense. I mean, that's kind of a common pattern in IR, right? Someone comes out with something new and innovative, it's like, that's not going to work, And then you have some data works like, this is the best thing, and everyone learns how to do it, including other specialties at that point,
Yeah, that's right.
But there's some probably things that you could draw parallels with now that are coming out that people are hesitant to use, and me included for some of the newer technologies because they don't have the same data. But disruption is pretty important, especially in our specialty, which really involves like people driving, bringing new ideas, disrupting what is currently available, and that's what we're known for. So I'm glad we have pioneers like Fred to bring stuff like that and then share a story.
That's right. So lots of patients been treated, lots of tumors been ablated with this system. One of the other things I want to talk about is how pissed the IR community is that we're winding down Neuwave. Not we, Johnson & Johnson is winding down Neuwave, right? I mean, is that sentiment shared? I mean, you guys have 4 microwave ablation systems. I mean, I imagine you guys keep them cooking almost every day.
Yeah, it was, I think just in our group, people didn't believe it at first, kind of shocked, like, oh no, that's like a fake news, right? This is not not real. Someone started to rumor. But then, they sent out that letter, and I think it was weird when it happened because it was kind of like right before SIR.
Right, yes.
And so it was like this, like, okay, you might have heard of it. Some people have heard of it. There's like a little chatter. Is it real? And then SIR, everyone kind of finds out at the same time. And so it's kind of a perfect storm for not just our group, but a lot of people in the, interventional oncology community to be like, what is going on? Like, why is this happening? And it kind of it led to a lot of speculation too. Like a lot of people try to guess like why this would happen. Like, why would you take the best performing market leader in microwave ablation and then disappear it? And so I think just the timing of having everyone come together, plus all the alcohol that happens at SIR at the same time, led to some pretty impressive conspiracy theories. So I even heard like Doge was involved at one point, like maybe Elon got in there. I didn't hear that, but it was just an important time. And I think people were pissed. And on a more serious note, people rely on this, including me, to treat people. And so that is real. They weren't like mad that they weren't going to have like specific vendor, but like something they've invested in. I know I've personally invested in it, trying to make it better, work on new software. And I just like, I'm so familiar with it that it's so easy to do ablation now. Like I know how it performs in different situations. I know what it can do. And to like have that kind of safety net go away is, can be upsetting. And it's like, why did this happen? And it can be a little jarring. I think it wasn't just me. A lot of people kind of had that same sentiment at SIR. And I think for better or worse, people have recognized that people were not happy that they built a relationship with this company and come to rely on this tool to do things that are really important for their patients. And there's a bit of a responsibility there to make sure that happens in a manner that allows people to learn something else or to pivot to something else, or maybe to let this technology live on in a different way.
So that's a good segue. And I know the answer is uncertain because we talked about it or emailed a little bit back and forth before the show. Any ideas as potentially Neuwave does live on in some other form with another company, something?
You got to be really careful here. I got to measure my words, but I think I can do it. So first of all, this is all my opinion. So this isn't like any insider information. I haven't got anything from anyone. However, I think from what I've heard is that J&J is pretty committed to not having this in the future in one way or another. So it's not going to be with J&J. And that's like, I think, hard truth. But I think that my hope is that they kind of heard some of the reaction at the SIR community and through various people they talked to, that they may be reevaluating or, just trying to see if this could live on in a different way. Is there another company that could take it over? Again, this is all my speculation, but I think that my hope is that they did hear that reaction and maybe are open to looking at other places where it could land. And I think, it could shutter and go totally away. And that's, certainly a scenario that is likely and may happen, but it would be pretty cool if it landed with a different company. I think that'd be potentially a fun place to be. J&J has been great, has grown Neuwave and allowed it to, really be a market leader and treat a lot of patients. But J&J is a operating room company. It's not a, IR company, and that's okay. But just like thinking out of the box, would it be cool if this landed with a IR centric company that kind of had interventional oncology as one of their main sites that they work on? So I think that could be cool. The product is great as it is, but just like any other product, you need reinvestment, you need development, you need people working on research, you need a company kind of devoted to that. So I think there's a lot of places this could end up and be pretty compelling and kind of fill up their toolbox as a place to land that maybe would be willing to take it to the next level. But I have no idea if that's the case or who that would be.
Got it. So you mentioned Neuwave as a market leader. Do you have any idea how in the lead they are? Can anyone ballpark how many ablations get done with Neuwave? For some, at SIR, I heard a couple of people say it's 50%. They have 50% of the market share, 60% of the market share.
Yeah, I've heard over 50%. Yeah, of the market share. And I think that's also probably decreased a little bit over time.
Sure.
They, for 6 or 7 years, were the only real player.
That's right.
And so it's pretty hard there's nowhere to go but down from there. You have other people building machines, and they've seen what the shortcomings are, and they've built machines and probes and programs that maybe address some of those. So I think something we can certainly get into more, but I think it's gone down a little bit and it didn't really have anywhere to go but down.
So not that and I don't pretend that this podcast is business people talking about business stuff, but it just seems strange to me, and I'm just going to put this out there, that you have a product that is at least clinically successful. I don't know the business of it, but doesn't it make more sense to just sell it rather than shutter it? Right? Even if you can get something for it, isn't something better than nothing?
I'm the same boat with you.
Okay.
I'm not a business person, but to me, it makes a lot of sense as well. And from what I've heard, they did look around just kind of quietly. But I think, again, I hope that they kind of heard some of the response and maybe looking a little bit more actively now. But yeah, to me, it didn't make sense to be a market leader in something and then to just be okay, we're done. But, they may be pivoting different direction, focus on a different thing. It's possible it needed reinvestment to kind of keep up with the competitors. It's not something they wanted to do. I don't want to speculate what J&J is thinking. I can't possibly do that, but it did strike me as weird to try and not get something in return. There's a lot of conspiracy theories about that. I'm sure you've seen some of the memes. I'm not a big socials guy, but there's some pretty fun pictures going around that other people have showed me about why J&J may be doing this and what their other investments are right now. But I can't speculate as to whether any of that is true. But there are new competitors coming out that I know J&J has relationships with, so I'll just kind of leave that with that.
Sure, fair statement. Yes, I've seen some of the memes, and they are quite funny. So if anyone wants to check them out, I don't know if we can link to them in the show notes, but maybe we'll try. All right, so let's assume that Neuwave goes away forever. So this product will not be available. Dr. Lookstein posted like some J&J correspondence to their customers that we can link to that, and it's got some dates on there about when things are becoming unavailable, when support is unavailable, when probes, you won't be able to get any new probes. We'll link to all that. We're not going to go through all the dates, but I just want to hear from you, Josh. The MD Anderson, a system that's got 4 microwave systems. What is y'all's plan? And I'm hoping that people can learn from what you guys are doing as far as like how they can prepare.
Yeah, I think it's going to be a little bit tending dependent. There's some people that have already really started experimenting and doing a lot more cases with the Medtronic device, the Emprint device, which I think has some advantages in certain ways for sure. And I think those people have started to look for opportunities to use those, especially in easier cases, as they know that they're not going to have the ability to use the Neuwave product for indefinitely. There is a little bit uncertainty. I think we'll know by June, have a better idea whether Neuwave sticks around in some manner or with somebody else. But I'd say I'm like kind of mentally preparing to move on from it as well. So I've started demoing and looking at what the other companies can offer. So my approach is going to be to gain experience over the next year. So, I mean, I feel like we should have, and I have some dates here too, but I would also say, check with Neuwave, make sure all these are correct,
right.
Appropriate disclaimers and all that. But, some of our systems are going to go away December, and really the last shipment of any new probes is going to be March 31st, 2026. So with that in mind, I have like a little less than a year to switch over entirely. So I'm looking for opportunities now to try new devices in easier cases where I have a little, not something where I need it to be very close to a critical structure and I really need to know how it performs. Something that has a little bit more margin for error. I don't mean error like something really goes wrong, just like it's okay if you take out an extra thimble full of liver. That's okay. And I'm probably going to start doing that maybe 20-30% of cases over the next like 6 months. And then really start to try and learn that device in a safe space or the new devices, whatever we choose to go to. And then kind of wind down in the next 6 months after that using the Neuwave device. Because I don't want to be reliant on this and like, I'm a Neuwave kind of guy, and I don't want to like cut off March 31st and feel like I'm going back to, my first day of residency, or first day of being attending and not know how a product works. So I think we're looking a lot at the Medtronic Emprint device, which is already in-house. And then we've worked really since SIR, when I heard this was all happening, worked really hard on trying to bring in the new Varian device as well.
So I totally agree with you in that, like it's such a smart thing to do is start demoing other devices, using them in cases that you're comfortable with and what it's going to be kind of a slam dunk microwave case, and you don't have to know every nuance of the device. Is there just putting out other things maybe for people who have trouble getting a new device or just have their head in the sand, you can get caught with their pants down as far as like, oh, now you don't have microwave at all. Is there any utility in or is anyone doing more cryo in the liver? Is anyone like transitioning like you can do some of these cases maybe with RadSags or?
I think that's the RadSag part has kind of been transitioning over the last few years anyway.
Sure.
And I think for the HCC population, sometimes I prefer that. But a lot of what we're doing in the liver is, metastatic disease, especially megacolon. And the name of the game there is like not injuring as much liver as possible. So if I have a 2-centimeter tumor and I can take out a small margin around it versus taking out a whole segment, I know they're going to recur in the future. I'm going to be playing whack-a-mole for hopefully 5-6 years, God willing. And if I can preserve as much liver as possible when I do that, it's going to be better for them in the long run. RadSag certainly has this place, or even doing some kind of, you have a very hypervascular tumor, then you're really not affecting too much normal liver. I think there's some argument to be made there. But in like general metastatic disease, when we know we're going to be fighting a longer battle, I really try and stay away from taking out a whole segment for one metastatic lesion. But I've certainly done it. It's just not my preferred approach. Cryo, I don't think there's a lot of people moving towards cryo in the liver. That could certainly change. I've used it infrequently, usually for stuff on the margin, like near the chest wall or anywhere I need to feel like a little bit less, a little bit more forgiving space. I've definitely used it. It's just hard because microwave has just awesome data. The collision trial came out and I had a chance to sit down with the first author from that last week. She came to visit and went over that study. It's just like so compelling. You have this, randomized study showing like sub 5% recurrence rates over a long period of time, and you have 10 years at least worth of data. We have the coverall study that my partner Bruno just put out showing like how good we can be by getting margins here and how well we can control it. It's just really hard to like move to a totally different technology when you have awesome results from one that's available. So I think that most hospitals, hopefully people will hear Neuwave's going away, if indeed it does, and people will have at least the next year to like look at what the other competitors bring to the table and then at least trial those out. I would have a hard time believing a hospital wouldn't be able to like pivot to another vendor. Like, okay, we're losing this entirely.
Right.
Let's try doing something else. So hopefully this and other things will help kind of move that. I'm sure, in talking to Neuwave, they also feel a sense of responsibility for what they have. So I know they're educating the people that use them, trying to let them know these dates, like when can you use it? When's the last time you get probes? There's certain people that are trying to order like a ton of probes right now. Okay,
Sure.
we're just going to order all the probes we have before the tariffs hit and just order them all. And we're never giving you this capital back. We're just going to keep this machine and do it. But I know that Neuwave in the long run, that's not going to be supported. So I don't think that's the best kind of long-term strategy for microwave. So I would advocate, yes, buy a bunch of probes, but really I think the priority of the next year, if Neuwave goes away, is all predicated that it's not going to survive. But if it doesn't survive, I think that the next 6 months to 9 months learning a new system is pretty important.
That's a good question. So what are people supposed to do with their microwave systems at the end? Like, you're done with all your probes, you send the box back, or does...
Yeah, I think so. I got some dates too. I don't want to reiterate all of them, but I think there's a couple options. So if you have like a lease program, it's different versus if you bought it. And we have very complex thing. We have like, our contracts are a little nuts and each one's different. So...
Oh, really? I would have thought y'all would just be like, yeah, we're going to need 4. We buy 3 and get 1 free at MD Anderson.
We like buy one and one's leased, and they're all different. Okay. Unnecessarily complex just to keep our bureaucracy going. But I think in the end, there's a couple, you can even like hang on to it. You can just like, I'm going to keep this forever and use all the probes until they're all gone. And then at that case, you just like own the box and there's nothing you can do with it. And they're not going to like service it after a certain date. I have that date somewhere. You should check with Neuwave, but that's kind of like one end of the spectrum. The other one is if you do like own it, they will buy it back from you. And I would double check the dates, but I think the buyback is open July to December. So like this coming up, you can elect to be like, hey, we're going to sell this back to you. And then you can get some costs kind of back from the company for that. But I think they need to be able to do that by December 1st to say, hey, we're going to like sell this back to you. And then you can use it still until March 2026. So you say, hey, all right, we're going to sell it back, but we're going to use it until all of our probes are gone at the end, buy back from us, and we'll ship it to you. So I think that's probably what I would do if I had owned it. There's no sense in having a box, even if you get an extra like 10 or 20 or 30 ablations out of it. At some point, something's going to break, need to be updated. And then you're just going to have like a useless box, and they're not going to be able to service it after some date. So I would probably shy away from just like buying as many probes you can, keeping it for 5 years, and then you're stuck in the lurch anyway. So, but I think most people end up buying at that or doing the buyback program would be my guess.
What in the world do you think J&J does with all those microwave systems when they get them back?
Robots, bro. They're building robots.
Okay. I like that answer.
Yeah. Or move them into the OR and build robots.
Okay. All right. I'm just going to take that as fact.
That's all conjecture, by the way.
No. Just audience, you can take that as cold, hard fact. So have you talked to anyone? I know that I have the sentiment like the IR community, if you use Neuwave, if you're a new Neuwave head, you're pretty disappointed with this news. Do you have anyone that's using this in the OR, like any surgical colleagues and what their perspective is?
Yeah, I actually called one of them just before this podcast because I saw that you might be interested. Yeah. He was like, I don't care, to be honest. He was like, it doesn't matter. I'm going to use Medtronic or I'll use whatever. I don't know. I guess he sees it more as a commodity. Okay. I guess it's different if you can like move the stomach away with your hand. Right. You know what I mean? Like
you're just using it to carve a piece of the liver out. Right.
And they're used to using super high power anyway, right? They're like, even Neuwave, they use in surgical mode, it's like way bigger ablation. So for them going to Medtronic, they're doing mostly, really all ultrasound guided stuff where you can see everything. It's not like ultrasound going through like 5 inches of, Texas adipose tissue. It's like on the liver ultrasound. It's like beautiful. So I think they have a good visualization. They can move stuff away easier. He was like, almost it was like it's kind of a commodity. Like,
Okay.
next company, it'll be fine.
Okay.
And he actually mentioned they have another navigate that Medtronic has a navigation system too, where he puts like an infrared pad underneath the patient.
Oh yeah.
Can like help them get. We don't have it, so I'm gonna check out whatever that is, because I didn't think they had a really good navigation system. People use it in our group, are using it with castination with the robot.
Okay.
And doing a lot more robotic guided. And that's nice because the Medtronic needle is a little like more robust, a little beefier, doesn't bend as easily. So I think it actually pairs really well with castination or Epion, and they have their own AC. So I think most people are getting over the lack of ablation confirmation and navigation with the Medtronic device by using it with one of the add-on robotic companies.
There's no way Medtronic's going to let this keep going without ablation confirmation software. I mean, there are some people right now that are like chopping away on a keyboard making this stuff. And that's how I imagine it. Just I totally people punching on a keyboard.
And well, there's also going to be a lot of third parties. One that the coverall study that Bruno led and we all, worked on with patients, it's like a third party ablation confirmation. It doesn't have to be the microwave vendor.
Sure.
In fact, you can make an argument that a software company is going to do a whole lot better building one of these than a microwave company, med device company. So I think we'll see, and that software was developed, Christy Brock and Bruno at MD Anderson.
Nice.
So that's kind of, you should use that one, because it'll help us pay for graduation and our social events. Bruno, I hope you can kick some of that money back to us. But but that's a really nice product. And so I think you're going to see a flood of these third-party companies developing their own software that are going to start to make the companies themselves a little bit less important in developing the AC software.
All right. So final thoughts on J&J's potential probable wind down of Neuwave. Anything else left to say? I mean, we successfully steered away from every conspiracy theory, which people may be unhappy or happy that we did, but
I hinted at it a little bit.
Yeah, exactly. We hinted. We're polite gentlemen. Go research it on your own or call us offline. Yeah. Any final thoughts?
I'm still holding out that it doesn't happen. I think that this device, still has a lot of potential. And I'm, just biased because I use it and it would be nice enough to have to learn something brand new. But I think ablation, percutaneous therapy is really coming into its own. Like, it's already been huge, but we're seeing, just like we did for, PAD 15 years ago, that we're achieving the same results as surgery with fast recovery times, better local control rates in a lot of cases, equal progression-free survival. So I think we're going to see the growth of ablation all across the spectrum, and a rising tide raises all ships. I think all these companies are going to be benefiting from an increase in volume. It's not a zero-sum game here where, okay, now Neuwave's here, Medtronic has to, there's a lot more cases to grow the overall volume. So I think there's opportunities for a company like Neuwave, which already has a great market and people already aware of it and already own a lot of the equipment, to continue on. But if it doesn't, we'll find another way. We're IRs, we've been innovative and things have changed, and we've always found a way to not just continue on, but to push the envelope and get better every time that happens, and we'll find a way to do it here. And that's not going to be the same reaction as a surgeon who's like, whatever, I don't care, but we'll find a way to make it happen. So in all the ways, I hope it sticks around, and the more competitors you have in that space, the more all the companies are going to innovate. The more they're all going to invest with their IR researchers to do new protocols and new trials and make better devices. And so I hope there's more of these companies, not less. And so for that reason, I really do hope they stick around. But if they don't, we'll find another way.
I already feel better talking to you, Josh. All right, so that wraps things up. One thing though, somebody left us a review on Backtable Plus. I just want to take a second to say thank you to David Fox, who wrote, quote, "awesome," end quote. Thank you, Dr. Fox, for that kind review. To everyone else, thanks for listening to the Backtable Podcast. We'll see you next time. Josh, thanks for coming on the show.
Thanks, Chris. Take care, man.
All right, guys, thanks so much for listening. If you haven't already, be sure to follow and subscribe and rate us 5 stars. Also, share with a friend. If you do, who knows, there might be a Backtable hoodie in your future. If you have questions or comments, DM us. We're @_BacktableIND on Instagram, LinkedIn, X, TikTok, and Blue Sky. Backtable is hosted and produced by myself, Anish Parikh,
and Ruchika Talwar.
Our production team is led by Kieran Gannon,
Aaron Bowles,
Gabe D'Agrazio,
and Josh Spencer.
Design and digital marketing led by Brian Schmitz.
Social media and PR by Ann Dang.
Administrative support provided by Judy Dela Cruz.
Thanks again, and we'll see you next time.